They had me come shadow at their clinics. They invited me to conferences, and they reminded me really why I'm entering this field of oncology nursing. It's not often in life that you find something that gives you this feeling, but I'm really so fortunate to have found mine. And I know this is only just the beginning, and I cannot wait to see what the future holds. I definitely owe a lot of that to the Oncology Nursing Society for opening up all those doors for me and really getting me into this field.
You're listening to the Oncology Nursing Podcast, where ONS Voices talk cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast.
Hello, and welcome to the Oncology Nursing Podcast. I'm Jessica MacIntyre, president of the Oncology Nursing Society, and your host for this episode. Today, we're talking with Samantha Paulen and Tayler Covino, both of whom are new nurse graduates who I had the privilege of meeting at the National Student Nurses Association conference. We will be talking about their experience as student nurses, why they decided to work in oncology, and the value that ONS brought to them as nursing students. Let's begin with some introductions. Samantha, can you tell us a little bit about yourself and what inspired you to pursue a career in nursing? And since you've graduated nursing school, where are you working at?
Yes, Jessica, again, it was truly such a pleasure getting the honor to meet you at the National Student Nurses Association convention, and I definitely feel super fortunate to be connected with you. So let me tell you all a little bit about myself. I recently graduated with Tayler from the University of Florida College of Nursing, and my attraction to the medical field definitely began at a very young age. My grandmother was a labor and delivery nurse, and I have these vague memories of visiting her at the hospital where she worked at. Like many, I also began watching Grey's Anatomy as a young girl. My parents were playing it in our living room, and I would watch it in the background. Although I was watching this and I was very interested in it, I had this weird and strange fear of hospitals because of Grey's Anatomy, I thought that I'd be in the middle of an emerging code or a crazy, chaotic event in the hospital, and I would just freeze. So every time I visited my grandma at the hospital where she worked, I would latch on to my parents and hold on for dear life. And as I got older, my attraction to the medical field became more enhanced when I began watching Grey's Anatomy on my own and binge watching it along with every other medical show on television. So come high school, I took the opportunity to join my local first aid squad, and that's where I really discovered my passion. As I became more exposed to the many professions within the medical field, when I was arriving at the hospital, transporting patients, and arriving on scene in events, I discovered my love for nursing. And obviously, it's been many years since then, but I have never turned back. And now that I'm officially a registered nurse, I'm super excited. I'm going to begin my career starting at Memorial Sloan Kettering Cancer Center in New York City on the bone marrow transplant unit.
Thank you, Samantha. That's amazing. And I know that the Memorial Sloan Kettering position is a residency, correct? Is that what you're going to be doing?
Yes, it is going to be a residency.
Great. Wonderful. Tayler, do you want to go next?
Yeah, sure. So hi guys, I'm Tayler. And I've always been so passionate about helping others. And from a young age, I just knew I wanted a career that would allow me to make a real difference in people's lives. My inspiration to pursue nursing came from watching the dedication and compassion of the nurses who worked with my mother, who's a physician. I was always around her office and she always brought me to the hospital. So similar to Sammy, I've just had a lot of exposure to it. And their kindness and professionalism left such a lasting impression on me. And it was something that I always thought about, especially in high school when it came time to start thinking about college and a career. So then I started volunteering in a hospital and I spent all of my Saturdays volunteering, and it was such a rewarding experience. My favorite part of it was definitely the patient interactions. So when it came time to pick a major, I knew that that was something I could see myself doing for the rest of my life. So I chose nursing because I just love how hands-on it is and how interactive it is. And I just love getting to know people and just helping them in any way that I could. So then I went to nursing school at the University of Florida. And I'm currently working at the University of Miami UHealth Tower as a registered nurse. And I love it so much. And I'm so excited to be doing this for my career. And even though it's such a challenging environment, I find it so incredibly rewarding to provide care to my patients. And I get so excited to come in every single day. So loving it so far.
Thank you, Taylor. Are you working as a registered nurse or in a residency program as well?
Yes, I'm in a residency program as well.
Can you guys talk a little bit about that and why you chose to go into a residency program?
So I'm doing the University of Miami's Titan Keynes residency program. And I just think that this is such a great option for new grad nurses because they really do make the transition from school to the profession a lot smoother. You have a few weeks of onboarding and orientation, so you get to practice your skills and just learn about the environment that you're going to be working in. And they really orient you to your unit. And you have a preceptor, which is really nice. So you get to train with them. And you're just really supported by the whole team and by the entire program and hospital. And every day, I just feel like it's better and better. And I don't feel so scared to start as a new grad nurse. I feel like I'm going to be very prepared. And I think my hospital in particular has been doing a great job at preparing us for practice.
Similar to Taylor, I think that in this day and age, it's really important to have sort of a smooth transition from being a nursing student to a practicing registered nurse. And although we do learn a ton in clinicals, I feel like nothing ever truly equips you for when you are practicing as a registered nurse. So it was definitely on my agenda when I was applying to jobs to be a part of an accredited nurse residency program for new graduate novice nurses. And Memorial Sloan Kettering Cancer Center, their nurse residency program, stuck out to me in particular because of my passion for oncology nursing and being at a cancer center like Sloan Kettering that's at the forefront of advancements in cancer treatment and research is such a great place to be. And they developed an oncology nurse residency program that truly facilitates the transition and promotes the adoption of becoming an oncology specialty nurse because it definitely is a specialty. And I'm really excited to begin starting there in a few weeks.
Great. Thank you both for adding a little bit about what it means to be part of a residency program, but also why oncology nursing? What drew you to the profession?
I was first drawn to oncology nursing freshman year of high school when my grandmother, who was my ultimate best friend, was diagnosed with pancreatic cancer. And by the time they had caught it, it had metastasized to nearly every surrounding organ. And as I mentioned earlier, my grandmother was a nurse. So being a nurse, she was very stubborn. And when she finally had gone to the hospital after having a variety of symptoms, it was almost too late. The cancer was everywhere and there were not many treatment options. She had been a prior cancer survivor, and just between the quality of life and her old age, the treatment options weren't hopeful. And I remember the day that my mom had shared this horrible, life-shattering news with me, and I felt just so completely devastated and helpless because there was nothing that I could do. I was only 14 years old. I had grown up with my grandmother by my side. She was my bestest friend, my confidant. Growing up, both my parents worked full time, so I spent a lot of time with her and we really had such a strong bond. And I had a really hard time imagining what my life was going to be like without her. It all happened so quickly. Within a month of her diagnosis, she was in the hospital for a few weeks and then she went into hospice. She peacefully passed away in hospice care. But what stood out to me the most throughout this experience was throughout the many visits to the hospital and then eventually the hospice facility, I got to form relationships with her nurses and they kind of became a part of our family for that short period of time. It wasn't the doctors that I remembered that were on her team. I remembered the names of the nurses who cared for her like their own, and still to this day, I can recite some of their names. I'm sure we all know how hard it is when a nurse becomes a patient, so I can't imagine how challenging it was to be her nurse. And although, again, I was only 14 years old at the time, let me tell you, this was definitely one of the most challenging times in my life. And little did I know that this would shape me into the person that I am today and was extremely influential on my future career as a nurse. Upon starting nursing school at the University of Florida, I was coincidentally and fortunately assigned to a hematology oncology unit in my first semester. And it was then when I truly solidified my commitment to oncology nursing. What's so beautiful about the field of oncology nursing is that it allows me to combine my interest in complex medical care with also my desire to provide support and empathy to patients and families who are going through what might be the most challenging times in their lives. And truly, my favorite part about this type of nursing is the continuity of care. There's really nothing more special to me than being able to develop relationships with my patients and support them throughout their journey. It's incredibly rewarding, making such a difference in their lives and being able to witness the strength and resilience of patients battling cancer. And it's such an inspiration. Being able to provide my support both medically and empathetically is truly such an honor. And now being on the other side, going through these similar experiences that I went through with my grandmother, and now being on the other side as a nurse, I want to be the guiding light there for my patients through every step of the way, whether it's a shoulder to cry on when they receive this life-shattering news or a happy dance and a smile when they find out they are in remission. I vow to support and care for my patients the same way those nurses cared for my grandma.
Wow, what an amazing story, Samantha. And I think we're all touched by someone that we have loved or that's a friend that's been impacted by cancer that really influenced us as oncology nurses to go into the field. Tayler, do you want to go next?
I think what you said was beautiful, Samantha, and I completely agree with all of that. I think seeing the resilience and the strength in your patients is truly something that you want to wake up every single morning and you want to keep doing that and keep seeing that. And I think that's a great way to avoid burnout because it truly is such a passion and such a desire to pursue such a heavy specialty, because although there are such beautiful experiences, we know that there are such hardships that are also associated with this specialty. And I truly am touched by your story, Samantha. What drew me to oncology nursing was a combination of personal experience and a desire to support patients through some of their most challenging times. I think it's so truly rewarding being next to a patient with cancer and just being with them every step of the way. Like Samantha said, continuity of care is so unique to the specialty, and it really is so beautiful getting to see them go through this journey and hopefully into recovery. I also had a family member who was diagnosed with cancer. He was my uncle. And I witnessed firsthand the impact that compassionate and knowledgeable oncology nurses had on his treatment. And it really did leave such a lasting impact on me. Their dedication and ability to provide both medical care and emotional support moved me deeply. I love that aspect of the emotional support that you can provide, not just treatment. So this experience deeply inspired me, and I just always wanted to be part of a team that offers hope and comfort to their patients and their families. And I think we can see this in so many oncology units. So working in oncology will really allow me to build meaningful relationships with patients, provide specialized care, and continuously learn and grow because there's so much new information coming out every single day. It's amazing. I know that it will be challenging, but an incredibly fulfilling path. And I feel so privileged to be able to support patients on their journey.
Thank you, Tayler, for sharing that. I think, you both commented that there's many experiences that led you to become an oncology nurse. Can you just highlight maybe one memorable experience that left a mark on you during your time as a student nurse? Samantha, if you want to go first.
This one is definitely tough because throughout my student nursing clinical rotations, I actually was fortunate enough to have 2 semesters that were oncology units. So I really got to work with a lot of oncology patients and experience what it's truly like. This past semester, I was on an adult bone marrow transplant unit, which is why I made the decision to pursue this specific aspect of oncology nursing upon graduation. The one story that I always love to tell that really stands out to me in particular was my first ever day of clinicals providing patient care on the hematology oncology unit that I was assigned to. And again, I had always been really interested in oncology, and I felt fortunate, whether it was coincidental or it was meant to be and the stars aligned, that I was placed on this unit because I was truly so interested in this field of nursing. On this first day, my professor had assigned me to one singular patient. She wasn't trying to put a heavy load on us. We each had one patient. We had a list of tasks of things that we were supposed to do. And as a very nervous nursing student on my first day of clinical, I really had no idea what I was doing. So upon entering my patient's room, I introduced myself and I could tell that she seemed very upset and down. And I quickly warmed up. And after talking to her for a while, I learned that Long story short, she had lived on a farm by herself. She had family that was not nearby. And after she had gone to her local community doctor for what she thought was long hauler COVID syndrome, her doctor shortly sent her to the emergency room, where she then learned that what she thought was the long hauler COVID was actually lung cancer that had metastasized everywhere. They were already discussing hospice as the next steps for her. As you can imagine, she was absolutely crushed. Hearing this and hearing what she was going through, I really thought a lot about my grandma and how shattering that news was to me when she was going through that. So I really resonated with her emotion. She didn't have much family nearby, and she really had to navigate this life-altering news all by herself. Fortunately, my grandma didn't have to do that because my family was there for her. So since this was my only patient assignment, I made an effort to sit there with her for a really long time, and I tried to support her for as much as I could. And before I knew it, my first clinical was over. Although this was very challenging, I understood why I was so drawn to this field of oncology nursing. When I came back the next week for clinicals, I received a different patient assignment, but I had seen on the board that the same lady was there, and I went to go check on her. I knocked on her room, and upon entering, she smiled really brightly when she saw my familiar face, and she seemed to be in better spirits. Quickly, she shared with me that the doctor had just come in earlier to tell her that after they performed cytogenetic testing, she had a specific biomarker that qualified her for a targeted therapy, and the doctors were super hopeful that it would work. Ironically, she also discovered that this was the same therapy that her brother, who had the same diagnosis a couple of years back, received, and he was doing amazing still to that day. So every time I tell that story, I still get the chills. I can't even tell you really how this experience made me feel. There are no true words to put into perspective of how this made me feel. I remember seeing how much more hopeful my patient was. I remember sharing that excitement with her, just that smile, holding her hand, and experiencing this beautiful, amazing situation with her was truly such an honor. Although when I had left that first week, I was definitely emotionally drained, and I knew that this was my calling. But when I left this week, when I had learned this amazing news, I felt even more drawn to this field. I remember immediately after I walked out of the hospital doors, I called my mom and I told her this is exactly what I want to do.
Wow, Samantha, amazing story. It gave me chills as well. Kind of made me reflect back during nursing school for myself, how I had my first cancer patient as well and how I felt. And it was very similar to what you were speaking to, and how as oncology nurses, it just goes to show that we're not just there to treat the disease, but also the psychosocial and practical needs that every patient comes with. So thank you for sharing that story. Amazing impact that it looks like you made on this individual's lives. Tayler, do you want to go next?
I think every nurse really realizes from their patient interactions. And I also have very special stories. During my pediatric clinical rotations, I was on the hematology oncology floor, which I got really lucky with. My memorable experience was with a young child undergoing treatment for leukemia. These stories where we see children with cancer, we know it's so sad, but it was so impactful, and I'm really lucky to have had this experience. The courage and resilience he showed despite the pain and discomfort were truly inspiring. Kids are so resilient, and it's amazing to come in and see their smiles, even though they understand what's going on, and they still keep that hope, and they're so strong. So I spent time playing games with him and helping him to distract him from the treatments. Seeing his smile and knowing I could bring him a bit of joy to his day was incredibly rewarding. Despite his condition, he remained incredibly positive and grateful for every moment. He loved to share stories, and we developed a bond over our conversation. His strength and grace in facing such a difficult time taught me the importance of compassion and active listening in nursing. Initially, walking into the room from the start, he was very withdrawn and uncommunicative. So, although I just told you how happy and courageous and resilient he was, it took me a while to get him to open up to me. But this was incredibly rewarding as well. Through patience, I was able to build trust with him, and he eventually opened up to me about his struggles, and we began laughing and playing. This experience reinforced the importance of empathy and understanding in nursing, particularly when we're working with oncology patients. This experience, among others that I've had, have shaped my approach to nursing, emphasizing the importance of empathy, patience, and building strong, trusting relationships with our patients.
Thank you, Tayler. Goes to show that regardless of the patient population, you both emphasized how empathy is really important in oncology nursing and how we're known to be one of the most trusted professions, nursing in general, and how patients really rely on us to help support them through very difficult times like the ones you mentioned. So thank you for both sharing those amazing, impactful stories. Let's now talk a little bit about nursing education. How has that prepared you for a career in oncology nursing? What specific courses or clinical rotations did you find particularly beneficial in understanding oncology nursing?
As I did mention earlier, I was fortunate to have 2 semesters of clinical rotations out of my 4 semesters on oncology units, which I definitely have to say, hands down, out of all my nursing education, prepared me the most for a career in oncology nursing. But course-wise, I would say that pathophysiology and pharmacology was particularly beneficial to enhance my understanding of oncology nursing. And contrary to other students' beliefs and opinions, they didn't love pathophysiology and pharmacology, but I had always been super interested in the mechanism of actions of the different drugs we were learning. So I remember when I got to the cancer module, I was probably the most excited I had been for a module because I knew this was my true interest. And I found that learning the materials was not as challenging because I was so interested. Although this was only a very basic foundation of everything about oncology and cancer, the concepts were extremely complex and deep, but I was determined to be comfortable with the material. Now, regarding my clinical rotations, those are most definitely what truly prepared me. Although there is so much more I have to learn and understand in this field of oncology nursing, and I truly believe there will never be a day, no matter how many years I have worked as a nurse in the field of oncology, that I do not learn something. These rotations really provided me with knowledge, and they also just taught me how to be empathetic. They taught me how to care for a patient fighting cancer. They showed me what a true beast cancer is, and how Taylor touched upon earlier, it's not always happiness and sunshine. There's a lot of heaviness and negativity with this field. And it also showed me how every day can be wildly different from the prior day or the next day. In fact, every hour can be different from the next. And most importantly, it really showed me that every day is a new day and it's a blessing and another day to fight the fight and support my patients in any way that I can at all.
Like Samantha, I also loved pathophysiology and pharmacology. I know that's not very popular opinion, but I think pathophysiology really helped me understand the biological and physiological mechanisms of diseases, including cancer. It provided me with a critical understanding of how cancers develop and progress, which is essential for oncology nursing. And pharmacology, because knowing the medications used in cancer treatment, including chemotherapy, immunotherapy, and pain management drugs, really is crucial. And this course really just equipped me with the knowledge about drug actions, side effects, and safe administration practices, which is super important. My med-surg rotation actually provided me with a broad experience in managing a variety of health conditions, which really enhanced my critical thinking and problem-solving skills. I know we don't get to choose our clinical rotations, but even if you don't get placed on a hematology oncology floor or a bone marrow transplant unit, there is still so many opportunities to work with patients that have cancer in your med-surg units or other rotations. And you can also seek out opportunities to shadow. I shadowed on an interventional radiology floor, and that was a really great experience that enhanced my knowledge of oncology nursing. So there are definitely a lot of opportunities out there and where you can gain essential knowledge of oncology nursing and really get to see the patients who have these complex and multifaceted care needs. I touched on my pediatric oncology clinical rotation, but I really do think it gave me insights into caring for younger cancer patients. This experience really emphasized the importance of a holistic approach to nursing, considering not just the medical, but also the emotional and developmental needs of children who are battling cancer. I also joined ONS as a student, so it was a large part of my college education and really gave me great access to resources, being able to attend meetings, and just stay updated on the latest in oncology nursing with the articles that they send out, and just provided me with great networking opportunities with so many experienced oncology nursings who have such a wide breadth of knowledge.
Thank you, Taylor. I agree with both of you. I was not one to like pharmacology at all, but it definitely provided you a lot of great information. And when it did come to the oncology medications, I did get a little excited when I saw that in the course. But yeah, you're right, Taylor. You see cancer patients in every floor now, even in the ER and the ICU. So there's always opportunity to get that experience on some clinical rotation. And it's interesting that you mentioned how ONS really helped amplify your nursing education. So that's a great segue into our next question, talking about being involved in professional organizations and what benefits have you seen being involved in NSNA and ONS? And I know, Taylor, you answered this question, but Sam, I'll give you that to answer.
Yeah, definitely. So I really love this question because it's now my time to boast about how amazing the Oncology Nursing Society is and how much benefit it has truly provided me with. And of course, without the National Student Nurses Association, I wouldn't have been led to ONS, so I would not be here without them. But I discovered ONS in my junior year of college when I attended the National Student Nurses Association conference in Nashville, Tennessee. And being on the board with plans to serve as the vice president for the following year, I was super excited for this opportunity to attend this conference. And this was one of my first real conferences that would positively impact my professional career. And I was able to begin building a network. And since I knew that I wanted to pursue a career in oncology, I was even more excited when I got the schedule and saw that there was a focus session that was all about oncology nursing. That was really the first session that I signed up for. And the Oncology Nursing Society sponsors these sessions, and they bring guest speakers to discuss their passion for the field, which is how I actually had the opportunity to meet Jessica this past year, as she was the guest speaker for this past year. This session was absolutely amazing. I walked into the room by myself. I sat down kind of toward the back, and after the presentation, the ONS liaison shared his story about how he ended up in this job, starting as a businessman in the world of finance. And then he opened up the floor for student nurses to share why they were here. Quickly, all the students began sharing their stories, and usually I'm not too emotional, but I found myself painfully holding back tears until they just started flowing. When I looked around, I noticed every person around me in the room had tears rolling down their face. People were sharing such emotional yet heartfelt and beautiful stories about why they wanted to be an oncology nurse, and it all came back to the nurses who cared for their loved ones. I immediately, without hesitation, ran to the front. I introduced myself to the ONS liaison, and the lady was presenting, and I signed up for ONS, and I was elated to have found a group where I can connect with like-minded people and gain even more of experience into this dynamic field. I joined both the chapters, one near my university in Gainesville, Florida, and then I also joined the chapter in my hometown back in New Jersey. Since this was in April, I was going back home for the summer in New Jersey. And the first half of the summer, I was away in Europe. And while I was away, I had posted on the Oncology Nursing discussion board, just the general discussion board on the website. And I shared about my passions and how excited I am to join this organization and how open I was to meeting anyone. And within hours and days, I received a ton of messages from people who were offering to mentor me, have me come shadow, and everything else you can imagine. I really felt so grateful and lucky to have joined such an amazing community that was filled with people who were so willing to help me. I had people reaching out that were asking if I would like to come shadow at their clinics, their radiation oncology clinics, their hospitals, join different courses that they had. And I was really so fortunate to have found this community. I attended my first ONS dinner in New Jersey when I got back from Europe, and I went by myself, and I was super nervous when I walked into the room, and there was a room with a bunch of tables and nurses and scrubs, and I was most definitely the only student nurse there. And I sat myself down at some random table when I hesitantly asked if anyone was sitting there. By the time I left that dinner, I had left with a ton of friends who I still keep in touch with, and a ton of people who were so willing to help me, added a bunch of contacts in my phone, and I was just so grateful for this experience. once I went back to school in August, I was back in Gainesville. So I attended the first dinner that I was able to for the Gainesville chapter. And I met a lovely group of local oncology nurses who immediately took me in and really included me in everything. They had me come shadow at their clinics. They invited me to conferences, and they reminded me really why I'm entering this field of oncology nursing. It's not often in life that you find something that gives you this feeling, but I'm really so fortunate to have found mine. And I know this is only just the beginning, and I cannot wait to see what the future holds. I definitely owe a lot of that to the Oncology Nursing Society for opening up all those doors for me and really getting me into this field.
Thank you, Samantha. That's amazing to see how ONS and NSNA has really supported both you and Tayler during your time as student nurses. And to all the student nurses listening, ONS does provide free student nurse membership for those working towards being a registered nurse. And this includes access to all content on the website, our communities that Samantha was alluding to, where you can connect with other students and expert oncology nurses, free subscription to our award-winning oncology publications, free and discounted courses with NCPD contact hours, and so much more. So I urge you all to take advantage of it because as you can see, it's really benefited Samantha and Tayler. So now let's talk a little bit about the perception of oncology nurses or oncology nursing. I believe, Tayler, you mentioned about the negativity and heaviness. I heard from many student nurses at NSNA about coping as an oncology nurse, and student nurses and the public may perceive oncology nursing as emotionally demanding. How have you prepared yourself to handle the emotional aspects of this field? And what strategies do you use to cope with the stress and emotional challenges that come with oncology nursing?
I think having mentors is extremely important, especially those who are experienced in oncology. I've met so many mentors through ONS, such as Jessica, and I joined my local Miami chapter, and I went to my first dinner last month. And like Samantha, I met so many people who are so willing to support me in my career. And I also got their contact information, and they're now my coworkers. So I see them in the hallways, and everyone in ONS is just so willing to help all of the other members and anyone on your floor as well. I just know that I have so much support from my coworkers, starting as a new grad and learning all of these new skills and just getting oriented to my unit, but also facing the challenges and the heaviness that comes with it. So my mentors, they're able to share their experiences and provide a supportive ear when needed, which has been so amazing, and I am so appreciative. Learning from their insights has helped me prepare for the realities of the job. I also believe that prioritizing self-care is essential. I make sure to engage in activities that help me relax and recharge, such as exercise, giving time to my hobbies, and spending time with loved ones. Regular physical activity, such as yoga and going to the gym, have really helped me manage stress and maintain a healthy work-life balance. Practicing mindfulness and meditation has also been incredibly helpful in staying grounded and managing the emotional stress. These practices help me stay present, they reduce anxiety, and maintain a positive outlook, even in these challenging environments. It's really important to just set emotional boundaries as well to avoid burnout. Establishing clear boundaries between your professional life and the personal life really helps me maintain emotional well-being. Also, having a really strong support system is crucial. So I regularly communicate with my friends, my family, and my colleagues who understand the emotional demands of nursing. Knowledge also from continual learning empowers me to provide the best care possible, and ONS can give us a lot of access to this. So this has really helped mitigate my feelings of frustration or scaredness, which comes from being a new grad nurse. And also, lastly, just engaging in reflective practice allows me to process my experiences and to learn from them. I really like to journal about my day at the end of a workday, and this has just really helped me understand my emotions and be able to grow professionally.
Thank you, Tayler. Just so many great suggestions for our audience listening in. Samantha, anything else you want to add that Tayler hasn't and what you do to help you cope as an oncology nurse?
Yeah, I definitely think Tayler really touched upon a lot of essential practices that nurses should adopt when being in such an emotionally draining field. And I really like this question because it's very real, because we know that this field is so emotionally demanding and taxing, and it really is so important to prioritize yourself and your mental health. In fact, when I meet people or I speak with others that I haven't seen in a while, and I kind of give them a life update and I share that I'm going to be working as an oncology nurse, I get many reactions where people kind of express this hesitancy for me, or they're like, wow, God bless you, or I don't know how you're going to do that. Are you sure this is what you want to do? And I always make sure to share with them my why of why I'm doing this. And as we had mentioned earlier, everyone has been impacted somehow by cancer, whether it's a family member, whether it's a sibling, whether it's a parent, whether it's a cousin, whether it's a friend. Cancer is everywhere, and we've all been impacted by it. And who else is going to take care of these patients and help guide them? And I think that it's really important to express to people why I'm doing this, because it definitely kind of helps mitigate that reaction that I get when I express to people what I'm doing when I graduate. And then one thing that I do that really prepares myself for this field of oncology nursing is I take time to exercise, cook, spend time with my friends, go on different trips. And this summer, I really have had the opportunity to do a lot of that because I'm not starting my job until a few weeks. So I spent some time traveling around Europe with my mom, and I spend the weekends traveling and going on little trips with my friends. And then something that I practice that I had learned from one of my wonderful clinical professors when I had clinicals on the bone marrow transplant unit was an evidence-based practice that I believe Harvard published. It's called the 3 good things. This practice is just a simple prescription and a great way to reduce burnout and improve well-being. And let me tell you, it really works. During my last semester on the bone marrow transplant unit, we had one particular week where we dealt with a lot of loss and heartache on the unit. And during our debrief after these really tough days, our professor sat us down and she introduced us to this 3 good things exercise. And I remember I left a few days teary-eyed, emotionally drained. And as soon as I got home and I gained composure, I sat down and I wrote out 3 good things that happened that day. And it truly is just such a great way to emotionally debrief and appreciate the positivity in life. It really trains your brain to recognize and see the good that is always around us, especially in such a heavy environment. And I still practice this after any bad day, even if it's not with nursing. And I swear, if you haven't tried it, I really highly recommend it works. And then Taylor touched upon another extremely important aspect of having people that you can talk to, whether it's a therapist. It's really important to find someone that you can confide in. It could be a friend, a family member, coworker, ONS member, but finding and building that support network is essential to getting through this. It's important not to only lean on yourself, but lean on others, just like others lean in on you as a nurse. I find that seeking support from others who understand what you're really going through, like colleagues who are also working in the field or ONS members who are also working with patients with the same experiences, it really helps guide you through the challenging times. And it's almost essential to be able to get through this emotionally demanding.
Thank you, Samantha. I'm going to try those 3 good things. I do a lot of reflective journaling, but never thought about putting 3 good things. So I'm going to start trying that out and see how it goes.
Awesome. I highly recommend.
I also do a lot with our social workers on the floor. They do a lot what we call tea time, and they get together with the nurses on the floor after they've had a really tough day and just take a moment to drink a cup of tea, connect, and just talk about the day. So also look into the resources you have in your units, because there's a lot that maybe we're not looking into that can help support you all. So thank you for sharing that. I really appreciate it. And I'm sure that will help a lot of student nurses listening in. Although we had talked a little bit about the negative perceptions, many of you touched upon the rewards. Can you talk about some of the rewards in oncology nursing just briefly and maybe in 1 or 2 words?
I would say in 2 words, I would say connections and resilience.
I agree with you on that. I've met so many great individuals during my career in oncology nursing, and also it has made me become more resilient. And as I'm sure you all will, and many of our experienced oncology nurses are probably nodding their heads as they're listening as well. Thank you. Samantha, you?
I think that those 2 words really kind of wrap it up: resilience and connection. Another word that comes to my mind when thinking about oncology nursing is definitely compassion. And then another word is fear, because I feel like a lot of patients are so fearful, and it's just amazing to be able to stand by their side and help navigate them through that fear.
Thanks. So looking to the future, healthcare organizations are facing a shortage of nurses in oncology and overall. You represent the next generation of oncology nurses. As you look ahead to the next 5 years, what advice would you give current oncology nurses that would help other student nurses consider a career in oncology nursing? Tayler, do you want to go first?
I would advise current oncology nurses to share their personal experiences and stories about the rewarding aspects of oncology nursing. I think this would really help students consider a career in oncology nursing. We all have such personal experiences that we derive from when we think, why did we start this? Just hearing the good is really empowering and encouraging. Also, just highlighting those moments of patient recovery, even the bonds formed, and just the impact that you can make. I think that the positive part is not seen as much, because when we think about oncology nursing, our mind goes to a little bit of a darker place. But I think really highlighting the positive aspects shows what you can do. I was able to discover ONS through a conference, and I think going towards any opportunity that you have to learn more about it is so important. So if you see any career fairs or panel discussions that are going on about oncology nursing, go. It can really shift your perspective and change your outlook on it, and can really show you the fulfilling nature of oncology nursing.
Thank you, Samantha.
Definitely, you bring up a really great point. And as representatives, Tayler and I, of the next generation of oncology nurses, I, as Tayler mentioned, would really advise current oncology nurses to share their passion, share their experiences. That's why when you came to the NSNA conference and shared your experience, you really brought out so many students. And I remember after I saw your presentation, everyone came up to you afterward and shared with you how amazing your presentation was, because you showed the amazing aspect of oncology nursing that not everyone sees. Sometimes people associate negativity, but there is so much positivity. When I had attended your session at the NSNA conference this past year, and I saw Patrick, who I had met the year before, at the end of the session, I shared what a difference this organization has made in my life. And I really urge anyone who is interested to join, because it's kind of a no-brainer to me, a $0 enrollment fee, and you're able to join this organization. And even if you go to one dinner, you meet one person, it can really benefit you so much. You can meet a lifelong friend. And after the session, I had several students come up to me to ask me questions, and I was really super willing to speak with them and highlight how amazing the field of oncology nursing truly is. It's just truly important to highlight that stuff, because there's so many deep connections that you can form with patients. There's such a fulfillment that you get from making a significant impact on patients' lives. And that's what inspires me and should inspire others to consider this specialty. There's also a lot of growth opportunities, and I think it's really important to emphasize the growth opportunities within the field, and also just the advancements in cancer treatment can attract new nurses, because there really is so much advancement in the field of cancer treatment. There's so much cutting edge research going on and new therapies, whether it's immunotherapy, cellular therapies, targeted therapies. There's really just so much attraction to this field that unless you are exposed to it, you might not be aware of it. In my opinion, I really think experienced nurses can support and attract new nurses into oncology by serving as role models, mentors, creating different comprehensive orientation programs, like the orientation program that I'm going to be partaking in at Memorial Sloan Kettering is super comprehensive, and it really prepares new nurses for getting into a field like this. And again, as Tayler mentioned, this is why ONS is so amazing. It does everything that I've mentioned, and it's not just on a hospital level or even a system level. It's nationwide for every oncology nurse. So I really urge any nurse that's interested in this field just to join it and at least attend one dinner session.
Thank you, Samantha. I appreciate the feedback on the presentation at NSNA. It was great to be there and talk to so many student nurses at that time, like yourself, that were interested in oncology nursing and be able to guide them in that way and help them see if oncology nursing is in the cards for them. We did get a lot of people interested at the NSNA conference, and hopefully we'll continue to see more. Thanks to your efforts and Taylor's efforts as well for spreading that good news about ONS and oncology nursing. But also, as a new oncology nurse, how can experienced nurses support you now that you are registered nurses in the oncology field?
Yeah, I can touch upon that. I feel that specifically in this specialty, oncology nurses in particular are so much more willing to help versus, they say that sometimes as a new nurse, some nurses may eat their prey or whatever they might say. But I really think that oncology nurses are so willing to help. But sometimes you just have to really expose yourself and open up that door. Sometimes others aren't as willing. So I think one thing that's really important is to create a culture of open communication where new nurses are able to feel comfortable asking questions, seeking advice. I think that that's really crucial. And I think another thing is that experienced nurses should advocate for resources that support nurse well-being. They know best. They've been in this field for a long time. They're very experienced, and there's a lot of support and advocacy that can go on within this field, whether it be counseling services, peer support groups. But it's really important to ensure that new nurses have access to these tools that they really need to cope with these emotional demands. I know you touched upon that earlier, that a lot of oncology units have different support groups and stuff. So it's really important to be a part of those and share that connection and open communication with like-minded people.
I think support is so important, especially as a new nurse. I've been grateful to have so many colleagues, like I said, to support me, but this is so new for us. We're starting a new job. It's super overwhelming. It's super emotional. And I think having experienced nurses as friends and as mentors, as I touched on previously, can really help facilitate an environment where new nurses can share their experiences and their challenges and receive feedback and support. I think experienced nurses who have been in this for so long really have developed the best coping strategies. And starting adult life, there's so much that we have to figure out. And I think they can really help us just try to develop healthy coping strategies that are going to avoid burnout and help us progress and develop. I think just having a whole unit be able to celebrate a new nurse's career milestones and their achievements can really help boost their morale and motivation, especially in this specialty. And just being able to provide helpful, constructive, but also positive feedback can also help us to just grow and feel valued, because it is really scary. You're starting this new job. You have all of this responsibility. We just want support and we just want to feel encouragement, because it can be really scary. And like Sammy said, there can be a lot of fear surrounding it, but it is incredibly rewarding, and having people to back you and to support you and cheer you on is what really helps you get through these tough days.
Thank you, Taylor and Samantha, for this thoughtful discussion. The future is definitely bright with you both. So thank you for sharing your thoughts on many of the questions that we have. And as we come to the end of this episode, we'd like to ask a few quick fire questions to wrap up the show. How can student nurses evaluate their hidden or implicit bias about the oncology field?
So I think one really big thing with that aspect is by reflecting on your assumptions and attitude toward cancer, its treatment, cancer patients. I think something important that we kind of touched upon earlier that people often forget is that it doesn't matter what kind of nurse you are, what field you're in, you will always encounter patients battling cancer. You can't escape it as a nurse. So it's important to recognize that and then seek feedback from colleagues, participate in workshops, training sessions, and really expose yourself to the different aspects of nursing, especially oncology nursing, and be aware of your bias, because that helps uncover the bias and then address them. So facilitating open discussions with experienced oncology nurses about their experience also help to really provide valuable insights and any preconceived notions that you might have.
Thank you, Taylor.
I'm going to focus kind of on just reflecting on your behaviors towards oncology patients and the field. Like Sammy said, you can't avoid it. Any unit that you go into, you will have experience and you will have a patient with cancer. And so just knowing how to assess your own behaviors are very important. I think that's why it's so important to join something like ONS, even if you're not even working on a direct oncology floor. this is such a up and coming and robust part of nursing. And I think having the knowledge that ONS gives us is so crucial to any nurse's career. So I highly encourage anyone who is listening to really just consider joining, because you can learn so much and gain so much valuable knowledge and continuous learning.
Thank you both. I was thinking about just one more question. What do you think is a topic that's not often discussed, but you wish people knew more about?
I think something that's not often discussed is how interdisciplinary oncology nursing is. It's so cool because we get to coordinate care with so many different healthcare providers, including oncologists, surgeons, radiologists, social workers. It is so fun being able to gain feedback and knowledge from other professions. And some of the best information I've learned has been from other professions besides nursing. So I just love getting to learn other healthcare professions' point of views on it. And it's really, really insightful. I love just being able to adapt my knowledge from another profession's point of view.
Thank you. That is very insightful, because we as nurses tend to put everything on our shoulders and feel like we have to do everything for our patients. But we have so many people involved in the care of a cancer patient that we should definitely leverage those resources and knowledge that they can give us. Like you mentioned, add to our database of knowledge that we can enhance our skills and care for our cancer patients. So thank you for sharing that. Samantha, you want to go next?
Yeah, I think definitely one aspect, and I feel like we've touched upon this throughout this whole podcast, that's really not often discussed and looked upon when you think of oncology nursing, but I wish that more people thought about it, is the incredible emotional resilience and strength that these patients and their families have. They have so much positivity, courage, determination, and it's really incredibly inspiring as healthcare providers to be able to see that resilience, that strength that patients have. You see these patients who are literally going through the worst times of their lives, and every morning they get up with a smile on their face and they take on the day, and some of them never even shed a tear, even with the worst news that they're getting. And I think that oftentimes when, as I mentioned before, people hear, oh, you're going to be an oncology nurse, people immediately think, wow, I don't know how you're going to do that. It's so sad. It's so heavy. But there's so much positivity and courage and determination that is so inspiring. These patients need people who are strong to get them through these times and difficult times. And I think that it's something that definitely needs to have more light shined on.
Thank you, Samantha. We've seen a lot coming out recently about assessing the needs of our caregivers too. So you hit on a very important topic in reference to really being in touch with our patients and their caregivers and what they go through, and reflecting and seeing how we can help support them through the cancer journey. So thank you for sharing that. Do any of you have any final thoughts or advice to other nursing students considering a career in oncology nursing?
My recommendation for any current nursing students is that effective communication is so crucial in oncology nursing. I know as a nursing student, even as a young grad, we're so scared to speak up, talk to other nurses, talk to other team members.
So if you are considering a career in oncology nursing, one thing is remember that it's a field filled with, of course, challenges, but there are so many profound rewards. Take care of your emotional well-being, seek out mentors, support systems, and really don't hesitate to use available resources for professional and personal growth. I think oncology nursing really offers the opportunity to make a significant impact on patients' lives, witness their strength and resilience, and embrace the chance to build long-term relationships with your patients and their families. And just remember that your compassion and dedication can bring such hope and comfort to those facing some of their most difficult times. I really encourage everyone to expose yourself to any situation, take advantage of any opportunity you have, and really just make the best of it.
Thank you both for sharing your insights and experiences with our members and student nurses. It's been a true pleasure to talk with you today. As mentioned earlier, I want to remind any student nurses listening today that ONS provides free student membership, which offers many great resources and discounts on courses and other products. The Oncology Nursing Foundation also offers educational scholarships and grants to attend our annual ONS Congress. We've added the link for more information to the episode notes. Thank you to those listening to the Oncology Nursing Podcast. We hope this episode added insight and knowledge to be able to continue to support student nurses and early career nurses interested in a career in oncology nursing.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part in this episode by leaving a review wherever you download your podcast. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org. The ideas and opinions shared in this episode represent those of the guest and not necessarily ONS.